You're welcome to my channel. Thanks for visiting. Let's go straight to talk about Lisinopril. But I'll be taking the brand Zestril. The first note here is that Lisinopril is one of the ACEI medications, meaning angiotensin-converting enzyme inhibitor. But this medication is less helpful in blacks for treating blood pressure. But either black, white, Hispanic, Latino, Asian, anybody around the world will benefit tremendously from the use of Lisinopril if they have diabetic mellitus. However, it is dangerous in pregnant women because it has teratogenic effect. Don't worry, I will explain fully in a bit. Remember the effect on the blood pressure, even if you are using this for diabetes mellitus. Let me explain. I have said that ACE inhibitors will be helpful in handling blood pressure, but not in black people. Black or white or anyone is expected to be on ACE inhibitors if they have diabetes mellitus. Even if that is the reason why you're on this medication, remember that this medication is capable of bringing down the blood pressure. And why am I laying emphasis on this? The mistake should not be made to just prescribe Lisinopril 2.5 milligram or 5 milligram to anyone that is diabetic without following up with the BP value. If not, we can treat the individual to hypotension. Angiotensin receptor blockers will be helpful if angiotensin-converting enzyme inhibitor like Lisinopril side effects is worrisome, like cough. Still on certain things to note, this medication is an analog of enalapril, the lysine derivative of enalapril. The enalapril is the active metabolite of enalapril itself. So it is excreted on change in urine. And that is the reason for the emphasis on renal function test or the status of the kidney while on Lisinopril. I will get into that in a bit. It is not metabolized by the liver. It is water soluble. Later on we'll talk about methanol or ethanol solubility. Don't worry, we'll get to that in a bit. And won't bind to protein. That is why it's going to be excreted on change in urine. The half-life is 12 hours. Now, the different brand names could be any of these and even more. The classification. Lisinopril is an antihypertensive agent. It is one of the ACEI inhibitors, meaning angiotensin-converting enzyme inhibitor. It's a synthetic peptide derivative. You can glance through other ACE inhibitors. I call them prils. Everything is pril. You can glance through here. Now, let's talk about angiotensin-converting enzyme. Remember, this medication is under the class angiotensin-converting enzyme inhibitor. Okay. In Renin-Angiotensin-Aldosterone system, the enzyme called angiotensin-converting enzyme, for example, peptidyl dipeptide hydrolase, will act on angiotensin I. When that happens, it will convert it to the active form, which is angiotensin II. The angiotensin II is a very powerful vasoconstrictor. Besides that, the same angiotensin II has the capability to stimulate aldosterone release from the adrenal cortex. Remember, the adrenal gland is right on top of the kidney also. And then the summation of the effects of angiotensin II from vasoconstriction and the release of aldosterone will give the capability to increase blood pressure. That is what we don't want to happen. And that is why this medication was manufactured by the group of brilliant scientists to block the effect of this enzyme. Now, mechanism of action. To medical students and nurses, these will affect Renin-Angiotensin-Aldosterone system. We'll be dealing with adrenal cortex and the kidneys. Lisinopril is a competitive ACEI inhibitor. It prevents conversion of angiotensin I to angiotensin II. And that will decrease the level of the strong vasoconstrictor called angiotensin II. Then, if there is no vasoconstriction, then we have vasorelaxation. A drop in aldosterone secretion will mean that we have less water and sodium retention, but excretion of the same will increase, meaning excretion of water and sodium will increase. Note this, with this medication, with vasoconstriction and less effect of aldosterone, potassium will be retained. Why am I laying emphasis on this? We will know why hyperkalemia could be a problem with this medication. And of course, there will be volume reduction. Remember, there will be less water and sodium retention and more increase. So, volume reduction with vasorelaxation will all lead to the drop in the blood pressure. Now, uses. It's useful in diabetes mellitus, not to handle the glucose level, but for cardiorenal protective effect in acute coronary syndrome, particularly post-myocardial infarction. We can prescribe ACEI inhibitors for cardiovascular risk reduction. In heart failure, precisely heart failure with reduced ejection fraction, ACEI inhibitors will be helpful. Like I've said earlier, this medication is known as an antihypertensive agent. So, in battling hypertension, it will be very helpful, though less helpful in blacks, but helpful in Asians, whites, all other Latinos, everyone else, but less in blacks for hypertension. Useful in them also for diabetes mellitus, renal, and cardiovascular protection. In chronic kidney diseases with proteinuria, particularly secondary to diabetes mellitus, Lisinopril will be helpful. In renal transplant, post-transplant erythrocytosis, we can make use of Lisinopril. In all these conditions, have a conversation with your pharmacist. This medication can appear only in two forms. Forms of solution for per oral use, and you can find this brand and this strength. In form of tablet for per oral use, you can find the brand I chose, Zestril, under this strength from 2.5 milligram up to 40 milligram. Generic Lisinopril could also be found as tablet at 2.5 milligram up to 40, but Prinivil will be this strength, regardless of the brand available in your jurisdiction, just consider the dosage strength that the medication will be. Administration. Nothing so serious about it. To be taken per oral, with or without food. Now, still on administration, white to off-white crystalline powder will be soluble in water, sparingly soluble in alcohol, and completely insoluble in ethanol. If I may ask, just cracking a joke now, why will you even look for alcohol to take the medication? You want to boost? It's a style, right? Just use this medication with water, please. Dosing. Actually, nothing much. Just start low, like 2.5 milligram or 5 milligram. I will start with 2.5 milligram. It depends on the desired goal anyways, the BP value you are targeting. Okay, and we should all remember when the BP is low, like 80/60, no, I'm not going to give any amount. Okay, depending on the BP and the desired goal, you will give the dosage as it's appropriate once daily. The maximum, some will put at 40 milligram once daily, some will put at 80 milligram once daily. Just be sure that you are not sending the man or woman to early grave due to hypotension. Watch out for the BP and other adverse reactions. Contraindications. We cannot give this medication in the face of hypersensitivity reaction to this medication in the past or to any component of its formulation. In pregnancy, or a woman with potential to be pregnant, meaning a woman of childbearing age, will need to be extremely careful. As a matter of fact, once the pregnancy is established, no Lisinopril. It will be better to even have pregnancy screening done before placing any woman of childbearing age on this medication. In renal failure with glomerular filtration rate less than 50 ml per minute, no Lisinopril today. Still on contraindications, in hereditary idiopathic angioedema, don't give Lisinopril. Don't use this medication with aliskiren or sacubitril, but your pharmacist will be there to guide. In bilateral renal artery stenosis, in fact, no ACEI inhibitor generally. Also, in unilateral single kidney, please keep Lisinopril off the table. When the woman or man before me is hemodynamically unstable, meaning the blood pressure is down, why should I give Lisinopril today? No way. Adverse reactions. Let me drop a note here that when I talk about adverse reactions or side effects, please don't run away from these medications, because no single individual will experience all the adverse reactions together. No, it might be one or two, and sometimes more than that in you. But your physicians will be ready to help you either to reduce the dose or change to another medication entirely. But truth be told, I must tell you what may likely happen. It's not that all these side effects will occur in you at once. No, not like that. Okay, some will have hypersensitivity reaction like toxic epidermal necrolysis, Stevens-Johnson syndrome, on account of which this medication will become contraindicated in them. There may be pancytopenia or aplastic anemia. Some men will run to impotency, and there may be change in smell or taste senses. There may be muscle pain or chest pain. Still on possible adverse reactions, non-productive or dry cough may be present. Remember, I said you might switch to angiotensin receptor blocker if this is worrisome. Remember, we are dealing with a medication that is capable of reducing blood pressure, right? If care is not taken, we can be tilted to severe hypotension. Orthostatic hypotension is very common, particularly in the elderly, and some will go into syncope. Now, more on adverse reactions. There may be dizziness, acute kidney injury from decreased blood pressure, and decreased kidney perfusion. So, kidney hypoperfusion, leading to decreased glomerular filtration rate. So, acute kidney injury is a possibility. Now, angioedema can occur, and that is as a result of increased level of bradykinin and substance P. You know what? Blacks will suffer more when it comes to angioedema in Lisinopril than the rest. Hyperkalemia, yes, this is a big problem. From decreased glomerular filtration rate and decreased potassium excretion, then we'll be faced with hyperkalemia. Now, I'm back. Let's talk about potassium in this case. With excess potassium, that is hyperkalemia, the individual with this condition will have weakness, shortness of breath, chest pain, tingling sensation, nausea, arrhythmia, form of palpitations, loss of movement. Other possible adverse reactions will include fever, pancreatitis, particularly on anyone on this medication for a long time, leading to diabetes mellitus. And someone will ask me, but you said this medication is good for someone with diabetes mellitus. Then, when pancreatitis will lead to diabetes mellitus, what is the advantage? We are using it in individuals with diabetes mellitus because of its cardio-renal protective capability. But we always go for low dose in DM patients. So somebody on high lisinopril dose for a long time, you need to rule out pancreatitis that can lead to diabetes mellitus, blood vision, and even myocardial infarction or ischemia. Monitoring. The clinical state of the recipient will be followed, and that will include the vital signs, the blood pressure, the heart rate, the respiratory rate, including temperature. Then we'll assay for the electrolyte level, potassium, sodium, and so on. Remember, I've just talked about pancreatitis and possibility of a GM from that. Renal function test, we need it. Liver function test, and complete blood count with differentials. Remember, aplastic anemia or pancytopenia. Again, let me remember to tell you that not everyone on this medication will have all these negative outcomes. No. In fact, majority will have none. Still on warnings, in end-stage renal disease, that will be a problem because it will lead to loss of adverse reaction. Like someone with chronic kidney disease or end-stage renal disease with glomerular filtration rate of less than 50 mL per minute, then we'll run into trouble. Hypersensitivity with anaphylaxis is a possibility. Remember, I've talked about toxic epidermal necrolysis or Stevens-Johnson syndrome. Since Ramipril can cause the following, then watch out for the following in Lisinopril as well: granulocytosis, bone marrow depression, and decreased hematocrit. Now, still on warning. Remember, this has the capability of reducing the blood pressure. A drop in the blood pressure will be dangerous in anyone with myocardial infarction, in stroke, aortic stenosis, peripheral vascular disease, and even in anyone generally, because you become dizzy, having orthostatic hypotension, and so on. Still on warning. Cautiously administer this medication in ventricular outflow obstruction, like hypertrophic cardiomyopathy with left ventricular outflow obstruction, please. Solution for pyorrhea that contains benzoic acid will likely lead to gasping syndrome, particularly in children. It is less useful for black people in the management of blood pressure in them. Also, not in women of childbearing age, particularly those who are not on any contraception. And when a woman had indicated that she's willing to be pregnant and actually working on it, don't give this, please. Drug-drug interaction. Those who are familiar with my channel will know that I will always leave this, to any pharmacist or clinical pharmacologist in your jurisdiction. However, for today, let's remember, all other antihypertensive agents can enhance the hypotensive effect here. Anything that can increase potassium is contraindicated while on lisinopril. For example, medications that are called potassium-sparing diuretics, like spironolactone, triamterene, amiloride, and the rest, are contraindicated. Diet that is rich in potassium, like raisins, orange, banana, plantain, and so on, are contraindicated while on lisinopril. Now, ACE inhibitors and pregnancy. Lisinopril, like the rest ACE inhibitors, will likely cross the placenta and cause massive injury, including malformation or death. It is better to avoid this medication or any ACE inhibitor in pregnant women and in any woman of childbearing age who is planning to be pregnant. Here, there will be renal damage in the affected fetus, and that will lead to decreased urine production known as oliguria, or none at all, called anuria. The fetus will be growing in an environment with oligohydramnios. Now, AC inhibitor and pregnancy again. Why the emphasis? It's pretty important. Someone with pregnancy taking ACE inhibitor like lisinopril may come down with stillbirth. Or if the baby is alive, within 1 month of birth, called neonatal period, the child may die. So neonatal death is a possibility. Why that? The child may be faced with lungs anomalies, like lungs hypoplasia. There may be skeletal anomalies, including skull hypoplasia. Remember, high level of potassium with drop in blood pressure and renal failure or may occur in neonates. So why not? Why not looking for another medication entirely? Please don't give those wonderful, pregnant mothers. Not at all. In conclusion, lisinopril is a good medication when used appropriately. though I have stated that it's less helpful in dealing with blood pressure in black people. But blacks, whites, Latino, anyone with diabetes mellitus and hypertension will still benefit. Remember the pregnant women, please don't give them. With that, I've come to the end of this short presentation on Lisinopril, a very good angiotensin-converting enzyme beta. Thanks for listening. Remember to share. I appreciate it.